Assalamu alaikum. Greetings from Morocco. I'm Professor Hinde Iraqi. I work in Rabat, and I'm very pleased to be with the DAR Alliance in 2025 to speak about mixed insulin versus basal bolus in type 1 diabetes during Ramadan. The question is, does it matter? And I would like to present to two of my patients. They came to my consultation last year. Aisha is 26 years old. She's a type 1 diabetes for her 16 years old. She is on degludec and analog rapid insulin. No complications, no comorbidities, and the A1C was right between 7 to 7.5% this year. She has also a CGM, and we can find that she had 3 hypos a week. And she's willing to fast Ramadan. And she said that last Ramadan she fasted without problems, even she had 2 hypos and many hyper. My second patient is younger. Ali is 19 years old. He's a type 1 diagnosed 6 months ago. He's on premix insulin, and he's experiencing 1 to 2 hypo a day. And he cannot afford more than 1 blood glucose every day. And he's also willing to fast Ramadan. So we know that we have many patients that are fasting type 1 more and more. In the last DAR global survey, 20% of them were fasting. And in those who fast, they could fast 30 days or less. As you can see here, in the DAR survey of 2020, we have 18% of them that could fast more than 15 days. And of course, they have to stop because complication that could be hypo, hyper, or ketoacidosis or dehydration. And what is very important to point is that they could have go to hospital admission, so the emergencies, 6.8% of them, they required emergency for hypo or hyper. So then many of you are going to say, wow, there is only one wise tip to say to them, not to fast. And of course, they are going to fast because it's their choice. So if you use the risk calculation and the risk score for type 1 diabetes, then you will see that both of them are in high risk, with the score of 8 for Aisha and the score of 9 with Ali, that is not doing any BGM, and he's experiencing many hypos a day. And both of them are asking for tips. They are strongly motivated. And Ali is saying they have no resources. And it's our duty to respect their decision, even if I have very few patients type 1 who are still fasting because I can convince them not to fast. But how do manage these two? And these two, you know, that you have the recommendation of the DAR. When you are on basal bolus, then you should reduce from 30 to 40% the basal insulin, and also to reduce the rapid analog insulin and to skip the pre-lunch dose. And of course, to have 7-point glucose monitoring a day. And when it comes to premix, analog or conventional, then you know that they are the least frequently used in our region, but sometimes you will see that many other regions will use it for type 1, and those should also reduce the dose during Ramadan and do at least 2 to 3 BGM a day. So this is their medication proposal for Ramadan. For Aisha, we shift from 20 to 14 units of degludec in iftar, and then for the rapid analogs we skip the lunch dose, and she began by 6 insulin at iftar and 4 at suhoor. And for Ali, we also split the dose, and he's going to take 20 at iftar and 6 at suhoor, and I asked him to do more BGM, especially if he experienced hypos. And of course, then you should see them the first week before Ramadan, and then the first week of Ramadan to adapt and to see if they need to higher the dose and to titrate. And I was really happy to meet them after Ramadan. Aisha said that she fasted 24 days, Ali 25 days. So he could fast 1 day more. And they both stopped because of hypos. And when you go to the literature, then we want to know which regimen would be, what are the different between the two regimens, and then you are going to see the recommendation of the DAR and what you could do for type 1. You are going to find many publications for type 1 and especially insulin pump or basal bolus. But there is a few data about premix insulin or the comparison. And here in 2024, there is this real world prospective study for the safety and effectiveness of the insulin pump. And you can see that with insulin pump, of course, you have more time in range period, you have less time below range, and it is good to have this for our type 1 diabetic patient. But of course, in our countries, there is difficulties to have it, and especially when you search for data comparing basal bolus regimen versus mixed regimen in type 1, there's nothing. There's nothing, but we have the data of our DAR global surveys of 2020 and 2022 that I am going to present you today. Be prepared. This is me when I saw the results. You are going to be like this in a few minutes. First, those who are thinking that no type 1 diabetes patients are taking premix insulin, just see that here. Of course, in the Gulf, they have more than 95% of the type 1 diabetic patients who are on a basal bolus regimen. But if you see in the Indian subcontinent, these 92 are on premix insulin. Especially, you have also in Middle East, Turkey and South Asia, and also in our Maghreb countries, people are still between 23 to 40% of them with mixed insulin regimen, especially because of the cost. And in the data survey, there were no statistically significant difference for gender, age, duration of diabetes, A1C, BMI. I'm not going to present you this, but let's see what is statistically significant with diabetic complication. Here you can see that even if there are more people involved in the study with basal bolus than in premix, that we have 520 with premix insulin and 1,619 patients on basal bolus, then you see that there is a statistical significance with the known complication, and it seems like those patients on premix have less complication than those on basal bolus. Those who have none has 37 or 38 comparing to 18, and neuropathy and microalbuminuria appears to be significant with less complication in neuropathy for those on basal bolus, and less complication for microalbuminuria for those who are on premix. For the data on patient fasting and how many days they could fast, here you can see that there are more people on mixed insulin that can fast 30 days, 43% of them, and 30% of those of basal bolus. And I'm thinking of my two patients as my patient on basal bolus. Isha fasted 24 days and Ali fasted more, 1 day, but it was 25. And it was surprising. What was also surprising is to see that those who has the intention to fast for Shawwal, they were more keen on fasting when they were on basal bolus. And what about hypoglycemia? in all the studies, we have the result that there are more hypoglycemia in premix regimen. And here, again, you have more patients that experience hypoglycemia with very good statistics than those on premix. It's half of them, 30% on premix and 63% on basal bolus. And if we see when they do, especially this hypoglycemia, then you found that for those on basal bolus, they are more keen on doing hypoglycemia between suhoor and 9 a.m. and in the morning. Maybe between suhoor and 9 a.m., they do not lower their dose rapid. We can suggest. And those on premix as I expected, they have more hypos than those on basal bolus between midnight to 3 p.m. It's the time of the peak of the premix insulin. And then what about hyperglycemia? Here you can see that it's again, that's why I was really surprised. It's again those on basal bolus that experience more hyperglycemia, and also during the day and during eating and during fasting hours. It was there are more people who experience hyperglycemia in the premix regimen. One very interesting question is to see if the patient follow the guidelines with the self-monitoring. And here you can see that there was only 26% in basal bolus and only 10% that of the people that were doing more BGM than before Ramadan. And there were 20% of premix regimen, they did not do nothing at all, and it's very important, and maybe they did not have any education program. And here then you can see that in the premix insulin, they did it many times, multiple times daily, and it's not the case on the premix. One of the explanation would be education. Here you can see that most of them, especially those on basal bolus, that have education in group with leaflet. It's more those on premix and online also on premix. And when you see the duration, you can find that there are less than 15 minutes spent with most of the patients on premix insulin, comparing to those on the basal bolus, because those on basal bolus, most of the education duration was 30 or more, 30 minutes or more. So maybe this is one of the explanation. So to answer the question, mixed insulin versus basal bolus in Ramadan, does it matter? These data are data, but it's very interesting. Of course, many of you, and I think that we should discourage patients from fasting. But if they want to fast, of course, we are going to be standing with them and helping them, especially with education. The premix insulin are not recommended for type 1. And especially during Ramadan, but in some region, my region and other region, they are still used. So maybe we should do something and more focus on premix. We did in 2014 a consensus for this premix during Ramadan. Maybe we should do more and focusing on premix for this population. So education is very important. And for those on basal bolus who are even doing enough blood glucose monitoring, maybe we should review the dose with the patient and ask the doctor to meet them again and to fix with them the dose, because it seems like they experience more hypo and more hyper. Thank you very much, and Ramadan Mubarak, say.